Now, how does IHL protect medical personnel? Um, we should point out that there is a distinction under international humanitarian law between two sorts of conflicts. International armed conflicts, namely conflicts between two or more states on one hand, and on the other hand, we have non-international armed conflicts, so-called civil wars. So conflicts between a state party and a non-state armed group, or conflicts between more non-state armed groups. And these two different categories of conflict are regulated differently, with international armed conflict being much more densely regulated by IHL than non-international armed conflict. But having said that, the rules of a more humanitarian purpose, they apply in the same way to international and non-international armed conflicts. So there is the most important rule when it comes to the protection of individuals affected by hostilities is that the wounded and sick shall be respected and protected in all circumstances by all belligerent parties. What do we mean by respected and protected? Respect means that, of course, belligerents cannot harm directly these individuals. So a wounded soldier cannot be shot at, or a civilian cannot be involved in hostilities, cannot be attacked. And protect means that they need to make sure, or they need to do everything they can in order to ensure that these individuals are protected from harmful acts which might be committed from other individuals. Okay, so this is a protection which goes down to the interaction between private persons, so to say. So that's the basic rule. Another rule, which is again more to the point, is the one which obliges state parties or parties to the conflict to shield anyone who has assisted a wounded or a sick from being molested or convicted or prosecuted for having done so, even if she or he is not a health professional. So during an armed conflict, everyone who takes care of wounded or injured combatants or fighters should not be let's say, face any sort of harm or molest for having done so. So this is, of course, the general rule which also protects medical personnel. With respect more specifically to medical personnel, IHL tells us that the personnel and also the facilities and mobile units, so ambulances, should be, again, respected and protected unless, and this is an important exception, unless they are used to commit acts which are harmful to the enemy. So if they are used for military purposes, then both the personnel but also the hospitals or ambulances, they would lose their protection. However, in the case of hospitals and ambulances, before, if they're used for military purposes, before a party to the conflict can attack them, a specific warning must be issued. And they can only be attacked if this warning remains unheeded. When it comes to medical personnel, again, another prerogative they have is to carry small weapons or to be escorted by sentinels which are armed. And this is meant to enable them to defend themselves and or their patient from acts of violence which, of course, might be forthcoming in such a volatile environment as the one present in armed conflict. So they are not meant to take part in hostilities. They cannot use these small weapons, and by small weapons we intend rifles or pistols or these sort of weapons. So they cannot use them to harm the enemy, but they can use them to defend themselves in case they are the object of an unlawful attack. When it comes to the ethical part of their activities, medical personnel or all the personnel which is engaged in medical activities shall, of course, not be compelled to perform any acts or to carry out any work which is contrary to the rules of medical ethics. So they cannot, for instance, be asked to prioritize certain patients over others, and the only guideline for them to decide which patient to treat first is, of course, medical priority. And this is also reflected in one of the basic principles concerning humanitarian assistance, which is the principle of impartiality. So you need to give aid first to those who need it more urgently. So no priority should be given, for instance, to soldiers instead of civilians, or to combatants of one side instead of members of an armed group of another side. Another right that medical personnel has is that of maintaining the confidentiality of information they have acquired while treating the wounded and the sick. The parties to the conflict shall not punish any health personnel who fails to provide information that it has acquired while carrying out its activities. However, there is one exception to this rule, and it is that this privilege is subject to the national laws of the party, which means that in certain circumstances, the laws of the parties might require health personnel to provide certain information. For instance, in the case that that information could be used to prevent the commission of serious crimes of which the medical personnel might have acquired knowledge while he was doing his job. Another right that medical personnel have is to wear the so-called protective emblems, which means that they are entitled to wear the Red Cross or Red Crescent, and this is an emblem which protects them from attack. It should be of a certain size, and all parties to the conflict are obliged to respect those emblems and to refrain from conducting attacks against individuals or units which carry those emblems.